Okay, so we're going to talk about, vaccinations for everybody. And as I ducked out at lunchtime today to talk to what we call a full selective, it's a group of second-year students that are interested in foals and neonates and things. Basically, anytime you have a preventive program or you're thinking about doing whatever, you can't do it in isolation. People will go off the deep end in nutrition or farrier care or vaccines or whatever. And if you don't have a balanced program, you're not doing a good job for your animals. If you don't have a balanced program for yourself, you're not doing a good job for yourself. So it's just, vaccinations are just part of a good health management, program for your horse. There's a lot of vaccines out there. Doesn't mean that every horse has to have all of these vaccines, but you should have some rationale of how you figure out who gets what and who gets what when aspect. So diseases that kill, to me, are really important diseases. If there's a vaccine out there that will prevent an animal dying, to me that's really, really important. Versus some downtime. Oh, I got the flu, I can't go run that, 5K today, I can wait till next week or whatever to pick up another 5K race. For me, no big deal, because I'm not going to run that 5K race anyway. I'm going to walk it. But it's not such that I'm a racehorse and I have to go to that race. I'm not somebody competing for the Olympics that I have to go for that. So selecting vaccines is going to depend, okay, what am I going to do? Is it just for fun? Do I really need to go to that, event? What kind of complications do I get? Are they kind of things that just kind of, well, I can't do something for a little bit, or are they, potentially causing some problems? What's in an area? Different areas have different concerns for some diseases, not all, but some, and we'll talk about that. And we already talked about what our horses do if, mine are couch potatoes. And really doesn't make that much difference if they're a couch potato that doesn't, don't have a lot of exposure to other horses. Then, some of these respiratory diseases are, kind of irrelevant as far as I'm concerned. And age, Dr. Tadros talked about age. Animals that are older may be more susceptible to things than younger animals. How much does a vaccine cost? And cost isn't always equated with efficacy or benefit of the vaccine. One of the more expensive vaccines is Potomac horse fever in relationship to what you get. And so we'll talk about Potomac a little bit, and you'll get my bias. You talk to somebody else, you'll get their bias, but you'll get my bias when we get to Potomac horse fever. What do horses do? Do they, couch potato like mine and don't, see other horses, or do they travel? And just like people, if you're getting on an airplane all the time, you're more likely to get things than if you're sitting at home. Some vaccines are more reactive. Likelihood to cause a reaction after the injection. Others aren't. Need to think about that. Anything that's potentially going to kill us might be of benefit that we want to prevent. We kind of like ourselves. So we want to, not do ourselves in. And one of the things we need to remember is no vaccine is 100% effective. No matter how good that vaccine is, it's not 100%. If we can get into the 90s, we're happy. So there's always going to be a small number of even fully appropriately vaccinated animals of any species that are not going to be, protected, and need to realize that. And then we need to make sure we vaccinate at the appropriate time for certain vaccines. And one of the main ones for that is our Encephalitis, Eastern, Western, West Nile. It's a mosquito-borne disease. And immunity doesn't last for a long period of time in relationship. So vaccinating in the fall is totally not warranted because our mosquitoes are going to bed for the winter. We want to have protection when mosquitoes at their high point. End of June, July, August, September, October in Michigan. We want those 5 months to be really covered. So if you have a vaccine that's only good for about 6 to 8 months, and you vaccinate in September, you've wasted your money, given yourself false security, and not done anything to protect your horse from getting into trouble. And then you need to know, is this the first vaccination they've had in their lifetime? Or, is this just a booster? Do they need, if you don't know, it's better to start the series over again. You spend a little bit of money, but at least you know the horse is fully protected. So again, initial series, and then, after that, it's usually just a yearly booster for a lot of these. But if you don't know, treat them as if they've never been vaccinated. And everybody will rattle this off to you. Oh, you got a 4-way, a 5-way, or whatever. It means absolutely nothing. The only thing you can usually be sure of, for the most part, and not even 100% that, it's had Eastern, Western, and tetanus in it. And that's not even 100% guaranteed. You really need to know what is in your vaccines. Nothing like asking somebody when you look at their animal, what are they vaccinated for? Oh, they're fully up to date in their vaccines. Well, what are they vaccinated for? Well, I don't know. They're just fully vaccinated, type thing. Basically, I don't like to use more than 2 injections at a time. And I keep asking the veterinary students, and I don't know if this group will tell me anything different than any other group, I don't know how many different things the body can respond to at one point in time. And I'll use the combination vaccines, but I still will only use 2 injections on 1 visit. I can be talked into 3 if it's a horse that's never had a reaction to a vaccine before. If they've had reactions to vaccines, I'm going to switch up companies. I'm going to start splitting the vaccines up so that they're not combinations anymore. And there are some horses that I will not vaccinate. Simply because, it goes back to what does the disease do and how sick does my animal get with vaccinating it, and try to decide if you do or don't. And I know getting titers for a number of these things are all the rage right now. And that's appropriate potentially for certain vaccines, but it's not appropriate for others that don't have a very long, protective period. So, and getting titers on your horse, it is not cheap either to draw blood and send it off and figure out what their titers are. So I tend to just recommend vaccinating appropriately unless they've had a reaction, and then I'll, kind of adjust it accordingly. Vaccination sites. This is one of the things that, unless you've thought about it, and I don't know if the mouse works on this one. Can we see it? Yes. Most, and I shouldn't say most, a lot of people, at least initially, would think that the horse's neck bones, their cervical vertebrae, were right here. But if you look at the skeleton, there's the head, and look where the neck bones are. They're right down there. And all up here is, not, anything bony at all. You have that big rubber band called the nuchal ligament here that kind of helps them hold their head up. And then you have this muscle mass. It's kind of inside this triangle that's a little bit tilted on this one. But this is, if you're using the neck, that's where you want to go. You don't want to be going in this area. And I have seen a lot of horses get so sore when you put a needle in that area and you put a vaccine in that they can act neurological. Just the light run of your hand down over the skin, if they've had a reaction over a nerve root, is enough to flip them over backwards on some horses if they're really sensitive. So you need to know I love the neck. There's advantages and disadvantages of every muscle mass that horse owns. I love the neck because I can do it by myself. If I have a client or a horse that I don't want anybody else involved with because of their temperament or whatever, I can do things to make it a little less painful to them up in the neck area. So I like the neck. Disadvantage of the neck is if you get a reaction, it doesn't drain very well. If you get an injection up here, find my mouse again, you get an injection up here in the gluteals, that's one of the really bad places to give an injection, because if you get a reaction, that doesn't drain at all. And if it does drain, it goes from here all the way down like this aspect. This is a great place because it has great drainage, but it's also on the kicking end. And so depending upon the temperament of your horse, do you want to be on the kicking end, aspect? Pectorals, I don't know if any of you in here have used, the pectoral muscles kind of up in the chest area. They actually work pretty well for vaccines or things. If they get a reaction, they drain really well. But there's no right or wrong muscle mass, I guess is what I'm saying. You select it based on the horse and based on, the veterinarian or the person giving the injections. The one big thing is always, always, always make sure you don't use the neck at a nursing baby. Nursing babies have to crink their neck like this little guy down here, they have to do that little snake thing to get their little head up to the teats. And if their neck hurts, they're not going to do it. So you don't give injections. It has nothing to do with muscle mass. I'd give a mini mature horse an injection in the neck day in and day out. I would not touch a neck on a Belgian foal. And the Belgian foal probably has more muscle mass than that little mini. But it's got to do with the fact they're nursing. I can raise feed up on an animal that's already eating solid food if their neck gets sore. I can't get a baby to do that little snaky thing with their head, whether they are doing okay or otherwise. So vaccines, there's a list of kind of the things that are out there. For the most part, I actually didn't put lepto on here. I realize that now when I just looked at this. But those are the things that are basically out here. The ones with the little asterisks, they're what the American Association of Equine Practitioners, AEP, calls core vaccines. There's 5 core vaccines that all horses in North America should get. Eastern, Western, West Nile, Encephalitis, Tetanus, and Rabies.
Question. Because I know the rabies vaccine all comes out of the same vial. Why is it could be 3 years for a dog, but every year for the horse?
They have not done enough titers, and also they're looking at exposure. Horses, they want a higher immunity because we're not running around looking if they're getting bit by a skunk or what have you. It's kind of like I would suspect the 6 students in the back have all had rabies. I've had a rabies vaccine. I routinely get titered in a rabies vaccine if needed. I would suspect there's not another person in this room that's had a rabies vaccination. Oh, Chris has. Okay, there are a couple of people. Well, Lisa, I forgot about Lisa sitting back there.
The vaccinations, I've had the series of shots because I was exposed by a horse that had rabies.
Well, is that your Texas story?
Because
Yeah, that's
I know that some studies have shown,
cowboy
at least in
story.
dogs, that the protection of the rabies goes actually beyond the
Right, and so does tetanus.
Okay, yeah.
But it's kind of like, somebody saying, okay, is that titer protective or not? And we know the vaccine, especially some of the rabies vaccines and rabies, and when we come to it, and we'll just skip over some of these when we get there. Rabies vaccines, different companies make different rabies vaccines where they get a different volume, depending on whether it's, put out by Zoetis or Mariel or whoever puts their, the rabies out. But the other thing is that certain companies, and you'll find that they no longer exist. They're kind of like incorporated into Fort Dodge and a little bit of BI. There was a company called Fort Dodge, and their vaccines tended to be more reactive, more chance of getting a swollen muscle if you use those vaccines.
I know rabies can be very reactive.
Yeah.
And all
So, but with the rabies, I told you that when we get to Potomac horse fever, I'm going to tell you my thoughts on Potomac horse fever vaccines. But the one vaccine that I do like it with Potomac horse fever is the Potomac rabies. And it's not because I want anything to do with the Potomac. It's the fact that the Potomac rabies is a very non-reactive vaccine. And so that if I have a horse that I'm worried about reacting to the rabies vaccine, I'm going to suggest they get the Potomac rabies because that's a very non-reactive vaccine. And as I said, it has nothing to do with the Potomac other than the vaccine. They're not going to react to the rabies aspect along there. So you get those core vaccines that everybody should have. And then you get the respiratory group, the flu, the herpes, rhino, whatever you want to call it, strangles. And for all of you in this room that may not have known it before, strangles is now a reportable disease in Michigan. As of a few weeks ago, Dr. Averill put it on the reportable disease list. That along with pigeon fever, which I don't think we've had diagnosed. It used to be something west of the Mississippi, and it's kind of creeping this way aspect. And then we kind of go into some of the other diseases that we'll talk about vaccine-wise. So tetanus, caused by Clostridium tetani. This is a spore-forming organism. Clostridial diseases, clostridial organisms live in the GI tract of the horse. They're also found in soil. They're basically worldwide. It's the one disease that no matter where in the world you are, you vaccinate for tetanus. Not often do you get tetanus, but if you do, you're basically dead. Even with a lot of supportive care, you don't have a good chance of survival. And there are 2 tetanus products on the market, if you're looking. You'll look in, whatever Jeffers or whatever, horsey little order book you have, and you have tetanus toxoid and tetanus antitoxin. Toxoid is the one that gives long-term protection. Antitoxin is only short-term protection, and you don't want to use that in any animal over a year of age because of this Tyler's disease or serum hepatitis, most likely related to a virus that gets incorporated into that antiserum. So, and I have seen horses, our medicine resident, or one of our medicine residents years and years and years ago, this veterinarian, seen this foal at birth, appropriately vaccinated it. It's now 2 years of age. He's going out to castrate it. Castrated it. He was worried, even though it had appropriate vaccinations all the way up to being 2 years of age. He gave it an antitoxin, came to the hospital, and died at the resident's feet of serum hepatitis. It usually happens about 60 days after, given the serum or the tetanus antitoxin. So don't use tetanus antitoxin is basically it in any horse over a year of age. And really doesn't need to be used in any horse that has an appropriate vaccination history. Tetanus, you were talking about rabies having long-term protection. Tetanus, we don't get, what do we get, a tetanus every 5 or 10 years now? And probably the same thing in horses. The only tetanus horses I've seen survive was an old Amish horse. It probably is a race horse that had a whole series of tetanus vaccinations, got a few clinical signs and survived. Probably because it had enough immunity based back when it was a young horse. So vaccine is very cheap, very efficacious. As far as vaccines go, you can't get a better vaccine. If you see one of these, you never want to see another one. They're agonizing to see. They get that really stiff sawhorse stance, their ears stick up, their eyes kind of look bulgy. They really react to sudden noises. They get to the point where they grab food, they can't open their mouth, and sometimes that's the way I've diagnosed them, is you try to open their mouth and you're going, oh, that doesn't make sense, and then you start thinking about it. We had one cow, I remember way back when we had a farm program, developed tetanus from a uterine infection. The Clostridial organisms grew in her uterus, and I'd seen her for retained membranes, seen her 10 days later, and you couldn't open her mouth, and she subsequently died of tetanus. So if you have a good vaccination history, I'm not going to booster them unless the injury's been 6 months to 9 months after the last vaccine. We had a horse yesterday that the students and I saw, older horse, probably has had a history in the past, didn't know what it was, gave her a tetanus. Tetanus toxoid is safe, tetanus toxoid is cheap, tetanus toxoid is very efficacious. So no big issues, just don't use the antitoxin. And the best antibiotic, if you're worried about something developing tetanus, is penicillin. It's an old antibiotic, it's been around forever, but it's the antibiotic of choice. So now we get into the encephalitides, and they're all kind of the same. They're basically viral diseases transmitted by mosquitoes and have birds as a reservoir. And these diseases can overwinter. Florida has already reported its first eastern encephalitis for this year. Horses are basically dead-end hosts. For eastern and western, we don't get Venezuelan up here, and if you're down in South America or Central America or something, and occasionally Venezuelan, and it's been a long time, will sneak up into the US, it has a high enough viral load in the blood that horses and humans may not be dead-end hosts. And by what I mean by a dead-end host is that if I get bit by a mosquito and I develop this disease, I can't transmit it to anybody else taking my blood. Normally taking my blood like mosquitoes and things. Now giving blood transfusions is a whole different ballgame. And West Nile was transmitted from one person to another with blood transfusions and with people donating their organs in car accidents or whatever and harboring or just coming down with West Nile before we knew that. But regularly, just by getting bit by another mosquito or what have you, we're not going to transmit it with Eastern, Western, or West Nile. So this is basically what happens. The mosquito and the birds just kind of keep this disease cycling between them, no big deal, until the mosquito gets off and bites a horse or a human or something, and then the horse or the human gets sick. And there are different types of mosquitoes that have different feeding habits, or I shouldn't say different types, different species of mosquitoes. Some mosquitoes tend to only like to eat one species. Some mosquitoes don't care. And that's why even in Florida and some of those places, we tend to see West Nile and Eastern encephalitis more at certain times of the year. Because at certain times of the year, there are more non-discriminant mosquitoes who they don't care who they eat on. Whoever's there and whoever has blood, come on over. We're going to have you for dinner. Where at other times of the year, it's more discriminatory mosquitoes that are out there. So clinical signs, you get neurological disease. And these animals can head press, they can circle, they can become very uncoordinated, they can become depressed, non-responsive. Most of them, but not all, develop fevers. And in the severe end stage of it, they develop, being down or recumbent. And once they go to the down or recumbent, it's basically, for the most part, game over at that point in time. How many get sick and how many die? A little bit depends on, which one of these diseases we're talking about. Eastern, Western, and Venezuelan are very bad. If you get it, you're likely going to die. And even if you don't die, you're never going to be normal again. Or the likelihood is very minimal. You can never say never. West Nile, 30 or 40% of the animals will die. And these are non-vaccinated animals we're talking about. But if you live and you get enough time, you're probably going to be normal or pretty darn close to normal, after that. So want to vaccinate for these diseases because, again, the vaccine is cheap and very efficacious, well over 90–95% efficacious. And if you missed a McDonald's or a Burger King meal, you're going to be healthier, and you've paid for the vaccine for your horse. So it's a win-win situation. You don't get into, having more calories than you need, and, the really high-quality, meals that you typically get at McDonald's and Burger King and those places, and your horse has been protected. Aspect. And contrary to popular belief, mosquitoes do fly over the Mackinac Bridge. Remember I said this is for all horses in North America that need those core 5 vaccines. When we started having Eastern and West Nile encephalitis last fall in the state, and Tom and I put out a bulletin, please vaccinate your horses, whatever. Somehow the UP people didn't read it, and all of a sudden we're having these mysterious diseases show up on Facebook that ended up being Eastern and West Nile. So mosquitoes are North American, can transmit these diseases. The nice thing is I like the combination. West Nile tends to be an expensive vaccine. The cost is more cost effective if you get one that's a combo where you can get Eastern, Western, West Nile, and tetanus in the same syringe. And that's typically what I'll use as long as I have a horse that doesn't react to that vaccine. And there are a couple of companies that have that multivalent vaccine out there. Because these are mosquito-borne, you want to give them in the late spring to early summer. Typically, we're not going to see these diseases till at least June. I like to vaccinate the end of March, early April. So if I get April, May, June, July, August, September, October, 7 months, November, I'm going to get it with one vaccination. And I don't have to booster. The only place that's not going to work is if I have a mare foaling in January or February. I've got to do her 60 days ahead of time, or pardon me, 60 days, 30 to 4 to 6 weeks ahead of time, and so she's going to be waning in the summertime. Then I'm going to rebooster her. Or if you live in Michigan in the summertime and you go to Florida for the winter, then you want to booster your horses more than once a year. And as I said, we haven't had any trouble with Venezuelan, so not something we want to deal with. And these are horses, these are West Nile horses. When we had the outbreak of West Nile that went through Michigan back in 2002-ish, horses will lay up. This horse right here, if he will stay like that and not fall over, and we can maintain him, support him for a couple of days, he may do all right. When they end up on the ground, they don't do well, or if you try to sling them and they hang there like a limp noodle, those ones don't do well. It's just not fair to the horse at that point in time. This is actually one of the first 2 horses in Michigan to be diagnosed with West Nile, and I tend to be pretty persistent in trying to keep things going, sometimes more so than other people over at the vet school. This horse came in a little bit hyperreactive, had a fever, was kind of high stepping aspect. Over the next day or so, ended up where you can see how her muzzle doesn't have any tone, her her tongue is kind of hanging out there, and she got to the point where she could not stand up. She just got herself plastered in the corner of the stall and wouldn't move. And there's no little stickers on these horses that said, I'm herpes, and I'm West Nile, and I'm Eastern, and I'm rabies, and I'm whatever. There's the potential she could have been a rabies horse. And the resident with me at the time didn't have a rabies vaccination protocol because she was from Australia. And so she wanted to kill her, and I wouldn't let her kill her. And 2 days after she was laid up against the stall, she started to recover. So she was, she was a lucky horse. One, because I don't like giving up, and two, because she never went down. She just you could not pull her off the wall. But she could have easily died just as well. Rabies, talking about rabies, this is the one, we can get it. And no matter what species gets it, you're likely to die. Very highly likely to die. It's fatal no matter what, mammal gets it. And it's neurological. And, Chris has got a really good story about, you don't always see neurological signs initially when you get rabies. And that's why I forgot Chris being vaccinated for rabies, aspect on this. But typically it's a neurological disease, but it can start as a lameness or a whole bunch of other things. And if you live in this part of the state, or you trail ride, or you do whatever in this part of the state, you better have your horses vaccinated, because that's where we see our large animal rabies in this state. And rabies in Michigan is typically either skunk or bat-based. That doesn't mean it can't be foxes and things, but the virus is traced back to either bats or skunks as the initial origin. We talked about the fact that, this is where I like the Potomac rabies combination, because it's non-reactive. But you need to know which company you're using, because some of them it's a 1 cc dose for horses, some of it's a 2 cc dose. Rabvac, that's put out by, I believe, BI now, is a 2 cc. So you need to know, what you're using. And again, it's a very effective vaccine. So now we're going to go from vaccines that are really good, recommended by the American Horse Association for every horse in North America, to vaccines that you need to talk to your veterinarian about. And you're going to get different opinions upon who you talk to. And, the big one is Potomac horse fever. We see lots of Potomac horse fever in Michigan. It's, just a given. They've changed names on it, so I've got both names up here for you. The life cycle is very complicated. It basically involves snails and a parasite that lives in them and flying aquatic insects. It's associated with wet, warm weather. And clinical signs is about anything. Any horse in Michigan that doesn't act right, as far as I'm concerned, in the summertime needs to be treated for Potomac horse fever. And, the vet students, ADR, it's kind of, everything is ADR. You just ain't doing right. It doesn't give you anything specific, just ain't doing right. And they tend to have a decreased appetite. Some of them act like they're colicky. When you listen to their guts, it looks like or sounds like you're pouring water from one glass to the other, like from a high height. Some of them will get diarrhea. They don't all get diarrhea. Some of them just develop laminitis. And they can abort. And a lot of them will abort weeks after they've had the disease. So even after you've gone through the acute disease doesn't mean if it's a pregnant mare that, she's not going to abort later, from this disease. And immunity does not last a long time. They're probably safe for the next year, but it's not a long-term immunity. Treatment, got to keep them hydrated. Anytime you have diarrhea in any species, got to stay hydrated aspect. Tetracycline is the drug of choice for treating this disease, and in the summertime, it's a pretty darn safe antibiotic for horses. And if I have a horse that I don't know exactly what's going on with it, it's going to get treated for Potomac horse fever. And then I'm going to give it some kind of an NSAID, bute or Banamine, not both, just one of them, and that's like you taking some aspirin when you don't feel good. And founder. And some horses founder, some horses don't founder, some years are worse than others. And we know there's a whole bunch of different strains of this bacteria out there, and the vaccine is only good against one strain. The company has not made, or companies, the drug companies have not made a new vaccine that incorporates the multiple strains. It's still the original strain they found along the Potomac River. way back when. And so it's a vaccine that if you want me to, I will use, but I don't hold very good stock in the vaccine as far as doing anything for the disease, except for when I combine it with rabies, makes the rabies non-reactive aspect. My own horses have never been vaccinated for Potomac horse fever. I'm a big chicken. When a new product comes on the market, I let my colleagues test it first on their clientele. And then if it's safe, then I'll use it on my clientele. And by the time I figured out Potomac horse fever was safe, I also figured out it wasn't that effective. Catching the disease early and treating it early is much more important than the vaccine. But if you want to use it, that's fine. I'll vaccinate your horse for Potomac, but just don't think your horse is going to be protected and not pay attention to the signs. Fever, colic, not acting right, all of these things. Anything that kind of acts like potentially Potomac in the summertime needs to be treated for Potomac. Influenza, I mean, just listen to the news, kind of the same thing in horses. The trouble is with our animals, they are not a very big economic return for the drug company. Somebody once told me, and I don't know how true this is, that Viagra makes Pfizer more money than all animal drugs combined. So you think about that. If you think Viagra makes more money than all the animal drugs combined, it doesn't say we're very high on somebody's totem pole about making new drugs or making a new Potomac vaccine or trying to make, and we can't even do this in humans yet, make an influenza vaccine that's going to work from year to year. When you look at influenza, you want to look and select a vaccine that has the latest date on it because it's been the last time they've looked at it or developed it and hopefully has better protection than some of the old ones out there. And if you look at Jeffers or whatever, that's why the price difference when you look at flu vaccines as to why some are more expensive. The intranasal product tends to be a little bit better. And research has shown we vaccinate foals for all diseases later than we used to when I first graduated. Again, influenza, no difference in any species. Basically fever, feel miserable, cough, all of these type of things typically are going to recover, but just like us, they can get secondary complications, not usual. It's usually more of a down disease. And my horses are pasture decorations, they don't go anywhere. They don't get these down diseases or down vaccines. Rhino, herpes, all of the problems you hear, all you have to do is open up anything and people are talking about which barn or which racetrack or which state has another herpes 1 infection and is quarantined. This is a reportable disease in Michigan, but not in Ohio. So you can be in Ohio and they can diagnose herpes 1 unless something has changed in the last few months that I haven't heard of. It's not reportable in Ohio, but it is reportable in Michigan. The herpes virus 1 and 4 causes mainly respiratory disease, can cause reproductive disease. Herpes 1 is the neurological part. And then you get varying others. There's now another one out there, herpes 5, people are talking about that causes some really nasty respiratory disease. It's not really treatable. And the standing joke about herpes is forever, unlike love. So once you have herpes, you've always got herpes. And foals usually pick up herpes from their dams in that first year of life from interaction. So most animals are going to have the herpes viruses. It's when they're stressed that they come out. So it's not like your horse doesn't have herpes, it just doesn't have clinical herpes. Clinical signs similar to flu. Vaccines are short-lived and they do not protect against the neurological form aspect. We're going to use these for pregnant mares to try and prevent abortion storms, not individual abortions, abortion storms. Because you can still, even having a fully vaccinated horse with herpes, have a herpes abortion. But hopefully, if you have good biosecurity and you have your horses vaccinated, you're not going to have all your horses abort. You're trying to minimize, you're trying to protect the bigger population. And again, do I use it or don't I use it in the non-pregnant horse? It's going to depend upon you and your veterinarian. And what do you do with your horse? If it's just going down the trail and you have a limited budget, core 5. If you have more money to spend, then you can start thinking about these. But remember, the respiratory vaccines do not have 100% or anywhere 90% protection. They're a lot lower, just like they're talking about the flu in humans right now. And this was a horse from Ohio in the Finley outbreak back in about 2000. You can see she's got a urinary catheter in. They can lose, when they get neurologic, they can lose the ability to urinate and defecate. Aspect. She's on IV fluids. Some of these horses will survive, but it's really, you got to decide, is it worth putting the horse through it at this point in time when they go down for any of these neurological diseases. Strangles, strep equi, reportable again, nasal discharge, fever, very short incubation period. And as I mentioned to Taylor's group, when I was up at Kettnan Center talking a little bit ago, is if you're trail riding, don't let your horses drink out of a tank if there's a tank next to the water. Don't dip your bucket into the tank next to the water and take it to your horse. If I passed my coffee cup around, how many of you want to drink out of it? And I don't think I'm sick at the time, but how many people want, and that's no different than drinking out of a community horse tank. It's different for your horses at home than going trail riding or whatever, because everybody is drank out of that. Everybody is snorted in that tank. Pump the water for your horse. Don't. That's going to be better. I mean, there's lepto and things, but that would be better, because that's moving water, and it's, but don't dip it out of a horse tank. You don't want to do that. And if you're doing a bunch of trail riding, or if you're doing endurance or whatever riding, and depending whether it's endurance or competitive, it's going to determine where you're going to water your horse from too. So I wouldn't worry about that. There's still risk, but the risk is much less than, out of a horse tank sitting by the water,
You said Strangles is now reportable. Is the incidence increased?
Well, it's only been a couple of weeks. Usually Strangles doesn't get ripping and roaring in any place until everybody starts doing their horse shows and everything. So we'll find out. And there is also a website, and I can never remember the initials. It's ECCM. If you just type in equine reportable diseases, it'll come up with a website, something along that, and you can look by disease and by state how many diseases have been reported. And it's a nice way to go if you want to see what's happening in different areas of the country or different diseases. So if you want to see how many horses have showed up with equine infectious anemia, or how many horses have showed up with whatever reportable disease that they're reporting, you can look there and it'll tell you where it's been, whether you're selecting by state or you're selecting by disease.
Okay, thank you.
Complications, you can get a whole bunch of different complications with Strangles. 90% of horses are fine. No big deal. Just like all the other respiratory diseases, it's the 10% that gets you into trouble.
Is there a recommendation at one point to give it to the younger horse? Was that it? Not, there was like, is it more?
Typically, we used to say that once you got Strangles, you had lifelong immunity. Number one, we know that's not necessarily true because there are a little bit of variation in strain, but the big thing is when I was a vet student, and they talked about lifelong immunity, is because horses in their teens were old. Now, do you think a horse in its teens is old? Heavens no, it's a great mount for a lesson horse, a first time rider horse. We expect we expect horses. I've known horses in their 30s to be active lesson horses yet. And Dr. Tadros talked about their immunity waning. So horses that get older, this is years ago now too, a lesson barn had Strangles go in, and a lot of their old horses got sick. It wasn't their young horses that got sick, and they actually lost one or two. But they were old, their immune system isn't as great, those types of things. Thank you very much, Alex. There's the website right there. So if you want to, type in the website.
What is the efficacy on the Strangles vaccine?
Okay, we're going to talk about that right now. Treatment, plus or minus antibiotics. Again, if it's non-complicated and it's an older horse, and by older, a year or older, and it's not a youngster, I'm going to be happy trying not to put them on antibiotics. Just give them a little bit of an NSAID again, kind of like us taking aspirin if we're kind of sick. If you are sick, you really need to be on antibiotics, and especially foals, young horses, or if you're having any major concerns, you need to be on antibiotics. And again, this is going to vary on the barn, on the horse, on the owner, what have you, as to whether you treat or not, but all young horses need to. The immunity is still long-term, but just not lifelong, and young horses are more susceptible. They haven't been exposed. So aspect. And if you get it on a farm, in my experience, it lasts about 3 months. When this farm, MSU Horse Barn, had it many years ago now, it took about 3 months to run its course here. And in my experience in other barns, if you have more than about 20 horses, unless you can quarantine it and do things effectively, it's going to take about 3 months to run. And it's really important biosecurity. I was the one that screwed up. We had research horses come in here, talk to Paula of all the things to try and minimize risk, and I forgot to ask her what she did with her manure. And the manure from the research horses got dumped over a fence that the 2-year-olds could reach over and were picking hay out of. And that's how the farm got Strangles. Because I assumed that the manure went over to the dairy barn and to be composted, and I didn't realize it got stockpiled for a while before it went over. So had we, had I asked that question, we wouldn't have got Strangles on this farm from the research horses coming in that were bought from auction. But I didn't, and we got Strangles.
So do you recommend the vaccine then?
Basically, again, depends on what your risk factors are. The intermuscular is not very good. 50-50 is like tossing a coin. The intranasal is better. But those complications like purpura and things you can get from the vaccine too. You can get it from both vaccines. So it's kind of, talk to your veterinarian, figure out what your risk factors are. And do I vaccinate or don't I vaccinate? Aspect from it. Because it's not a vaccine that doesn't have complications. And again, it's one of these respiratory vaccines. You're probably looking, even with the intranasal vaccine, that maybe 60-70% protective. Not like the core 5 that are well over 90.
So we do trailer into a stable for lessons periodically. So theoretically, if they had an outbreak and we heard about it, would we be able to vaccinate them and perhaps prevent it from happening to ours?
Now you never want to use the killed vaccine in the face of an outbreak. The intranasal, yes, people have gone in, if you can do good biosecurity, and thought that the intranasal helped. Now with it being reportable, or if it's a responsible stable, and if they think they have rabies, they should close, rabies. If they think they have strangles, they should be closing that barn down, and now they have to.
Not necessarily know right away.
Right away, right.
While we're there,
And if you're hauling in, and you haul in and the horse is at the trailer, and it's only in the arena, and you don't let them snuffle everybody, your risk is lower too. Okay. And don't share tack and water buckets and all of those type of things. Yeah. We'll go through these pretty quick here. Rotavirus is, if you have brood mares, it's a viral disease of babies. Same thing as like human babies or whatever. Each species has their own rotavirus. There is a vaccine out now. Really has done a lot as far as preventing rotavirus outbreaks, especially in the big Kentucky farms and that aspect. What is best for my farm? It all depends on what you do. What you're going to use. Basically, do I need one dose? Do I need multiple doses? What's my horse's previous vaccination history? How well do the vaccines work? Timing depends upon what your horses again do. If it's a broodmare that you want those fertility babies and they're foaling in January and February, you're going to have to booster them for the core 5, or not for rabies, but for the eastern, western, West Nile, just because their immunity is going to be waning if they're a Michigan horse when, August, September, October, when we're really in potential prime. But if you're a backyard horse or you don't go out of Michigan, you should be able to get away with one vaccine if you time it right. So everything is, based on, what your animals do. We talked about young horses. Don't start vaccinating too early on young horses anymore. Adult horses, if they have yearly vaccines, they're fine. If you have any questions, just treat them as if a horse has never been vaccinated before. It's not going to hurt the horse, only your pocketbook. One more McDonald's meal that you couldn't have. Brood mares, again, there are vaccines we're going to put in there for brood mares to try and keep them protected, and maybe we'll have to booster get in as we talked about with our brood mares. And then, again, it depends on what you do. Do you have babies? Do you have a little petting guys? Do you have show horses? Do you have couch potatoes like mine? It's going to make a difference as to what you're going to vaccinate for and what you're not going to vaccinate for.
So the registry that you're referring to here, will only those reportable diseases be in that? Or?
Typically, yes.
Okay.
For the state. And more states are getting more and more consistent. Like equine infectious anemia, when everybody kind of goes, oh, I got to do a Coggins test on my horse. That's going to be reported, and you can go for a long period of time. And it's really interesting to go to that website and all of a sudden see where outbreaks of EIA pop up, aspect. Or herpes, or pyroplasmosis, babesiosis, or whatever. But you can go there, and it's just rather interesting to look. Basically, most of the herpes, even if they're not reportable, will show up there as to what racetrack or whatever is closed down or stable or, what have you. Anybody have any questions?
Coggins,
Yes.
is that ever going to go away?
No, we just said EIA. You'll have outbreaks. That's what Coggins is EIA, equine infectious anemia. It will never go away. Theoretically, if we could test all equids and eliminate the positives, we could get rid of it. But even in states where you wouldn't expect it to be, there have been outbreaks. And I was trying to remember last year, if it was Kansas, somebody had a whole bunch of horses show up positive. I don't know if you want to look on, if you pulled up that website, Alexis. I think it was Kansas had a whole bunch of EIA horses last year that showed up. We've had, a couple of years ago, it was in the horse where there was a stable in, I can't remember the state now, Missouri, Tennessee, whatever, where multiple horses on a stable showed up positive. And do not use common needles. No. Aspect. Some of the backyard quarter horse racing, one of the problems with transmitting EIA and pyroplasmosis was common needle use, on those backtracks. What's that?
And those needles aren't that expensive?
No, they're not that expensive, but they were doing that, and they, showed up, being positive.
On the Coggins test, again, like every horse that's coming into the horse pavilion this weekend has to have a Coggins. And the trail riders in the state of Michigan, a lot of the clubs have decided not to require proof of Coggins. And is it something changed in the law in Michigan where it's optional?
Nothing has changed in the law. It's totally up to the groups. But if you're going to any fairs or Class A shows or things like that, you're going to be required. But nothing has changed as to horses that change ownership. Anytime you buy a horse from anybody, it should have a negative Coggins. That's required by law. If it's sold through an auction, required by law that it has a Coggins test so that it's negative for EIA. It's transmitted by mainly major biting insects like horse and deer flies. Insects that take a big blood meal and hurt when they bite. So that they start one blood meal on one animal, they get flicked off, and they pick it up off that animal, and then they go to another animal to finish their blood meal, and they transmit it. And needles. And castration equipment, and dental equipment. If you're having, and I don't care who the dentist is, whether it be a veterinarian or a non-veterinarian, coming out to do your horse's teeth, they better be disinfecting their instruments, because that's another good way of transmitting, So castration equipment, dental equipment, anything that potentially transmits blood or blood products. It's essentially a virus in the same grouping as AIDS in humans. It's in that grouping of, viruses. So anything that transmits, blood has the ability to transmit equine infectious anemia.
No, you can have your horse get a clear Coggins, say in the spring. Horse gets
2 weeks later can be bit by something.
Exactly.
It's right,
And-
but it's the best we can do. You can't
Yeah.
recommend somebody test everything.
No, because it's too expensive.
Right. So the best you can do, and that's why anytime and there's no requirement for horses going into a stable or anything to be, it's up to the stable owner whether they want to have a negative Coggins when the horse comes in. My recommendation, if you're having horses come in to a stable for the first time, you at least want to make sure they're coming in negative. So if everybody comes in negative, hopefully they stay negative. Whether they test on a yearly basis after that, that may be a little bit. But anytime a horse changes ownership, it needs to be, tested for EIA. And by law. Now, whether that's done or not is a whole different story, but I would really push to have that done for that reason.
Question on vaccines. We have trouble trying to decide when a horse might be too old to get a vaccine.
Never too old,
Okay,
as long as they don't react.
okay.
Now, whether their immune system, like Dr. Tadros talked about, is going to be as good in responding to the vaccine is another thing.
Right.
And I don't know Lisa, do you know of any, I've not seen any research where you get these horses that are metabolic or whatever, what their response rate is to a vaccine, because theoretically they technically may not respond as well because they're in an inflammatory state and their immune system isn't as good. But I would say never too old to be vaccinated, as long as they don't react.
Okay. Good to know, thank you.
Okay, well, thank you.